women, health, and the war in Ukraine. Women and girls face increased levels of gender-based violence and interruptions to maternal health care, among other grave risks. In addition to the obvious human rights violations of deliberately targeting a maternity and children's hospital, the attack highlights several gendered risks facing civilians in the Ukraine crisis. At such a moment, it's essential to think about the role that gender and health play in conflict situations, and how best to respond to related needs. Demographics in Ukraine. Prior to the war, Ukraine had a demographic profile that was highly skewed by gender. The overall population was composed of 54% women to 46% men. Of the 2 million people who have fled the country since the war started, roughly half are children under the age of 18, and men between the ages of 18 and 60 are essentially not permitted to leave the country, given the needs of the Ukrainian war effort. In part due to the highly skewed gender distribution of the Ukrainian population, the best current estimates from the UN High Commissioner for Refugees indicate that, prior to the conflict, nearly 60% of internally displaced persons within Ukraine were female. As a result, it is entirely reasonable to suggest that the health needs of displaced persons, whether they are in Ukraine or have fled the country, represent the needs of women to a great degree. Non-communicable diseases. In addition to the issues of maternal health and gender-based violence, discussed below, it's important to understand the problem of gender differences in the incidence and risk factors of non-communicable diseases like diabetes, obesity, and hypertension. Differences in exposure to non-communicable diseases account for a significant amount of the overall gendered population disparity. For example, the World Health Organization published a report in 2020 on non-communicable diseases in Ukraine, looking in part at disparities in risk factors such as smoking, diet, physical activity, obesity, and blood pressure. Here's what the gender distribution looks like by age group for men and women, specifically, their likelihood of having 3 or more significant risk factors. These risk factors tended to be somewhat more extreme for women and men in urban versus rural areas. However, the main difference is that Ukrainian men tend to die of non-communicable diseases at an earlier age than women do. Older Ukrainian women tend to live with the consequences and higher incidence of non-communicable diseases. Maternal health. Over the past 20 years or so, Ukraine has made significant progress in reducing the risks to women in childbirth. The current maternal mortality rate places Ukraine at the bottom end of all countries in and around Europe, and roughly on par with the United States. Applying that number to the current 2 million refugees who have left Ukraine, and estimating roughly another 1 million internally displaced persons based on pre-war reports, that would mean there are currently around 120,000 displaced pregnant women in and around Ukraine, with about 18,000 in need of emergency obstetric interventions. During the conflict, however, women are disproportionately at risk of being cut off to all aspects of quality maternal health throughout the entire cycle of care. The World Health Organization recommended prioritization for women in these situations as follows: improving access to reproductive, maternal, newborn, child, and adolescent health services for internally displaced persons and in the eastern regions affected by the crisis. Increasing the capacity of healthcare providers working in mobile emergency primary units by updating and organizing trainings with the inclusion of maternal and child health modules, and strengthening services in emergency triage assessment and treatment of children. Thanks for watching.